So both of you touched on the importance of this being a partnership. So we have health systems, hospitals, and physicians. And historically, there's been tension between those. But we know as MACRA goes down the road, it is really going to be much more important that physicians and hospitals are partners. So what are the most important messages physicians need to understand about these changes, and how can they plan and help with the hospital and health system?
You know, Kevin, it feels to me like it's really an opportunity for us to look at who does what best. Practicing to top of license is a phrase often used about us as physicians, and I see it as applicable to everyone who works within our healthcare organizations, whether they're technically licensed or not. Where are the content experts? Who are the data experts? Who's fantastic at detail? Who can prepare a really useful track and trend chart? And do we know who those folks are in the organization? They may or may not already be labeled as such by title, but they are the sweet spot for success in this sort of a program. So assuring that each organization has identified the best skill set of each of their members and applied it to the important components, the many important components of MACRA, feels really key to me to build those synergies. And you know, looking for synergies, there are examples where a particular skill set applied to one clinical area is extremely transferable to a very different clinical area. And without really analyzing a measure to understand whether it's something that's being done in real time or whether it's something where we have the luxury of a year to accomplish that on behalf of our patient, or is it something we need to do within a week or two? So is it somebody who came in with a sore throat and we need to have done whatever it is before they leave the office? Or is it someone who's due for a mammogram and so we have a year in which to accomplish that? Those are two extremes of the same of measures that are available to us. So a skill set that is successful at applying a program for an immediate need can be transferred to a very different type of clinical care, and building those synergies, understanding how those measures are in fact related, is really important for success in these sorts of programs, and most importantly for improving care for our patients. It also offers us an opportunity to see what we do well at, which is great, assess our strengths, and also identify what it is that would most help us to provide better care for our patient population. What do we wish we had the resources to do? How can we use this opportunity to create those resources to build a better program for a particular category of patient care or for all of our patient needs?
You know, hospitals and health systems are accustomed to working with physicians and other providers in their areas. But for the most part, oftentimes, even under situations of pretty tight alignment, what happens in the office stays in the office, and what happens in the hospital stays in the hospital, and never the twain shall meet. And that's been a comfortable position for everyone involved. That's not going to be adequate moving forward. It's just not. And it's going to require change in both the hospital side and the health system side, as well as on the practice side. To that end, whenever change is happening, it's uncomfortable. And the other thing that is common in scenarios with health systems and hospitals is that the administrators, and myself being one, I can say this, oftentimes feel like we understand what the other people in the arrangement need, and sometimes forget to ask what it is that they need in order to work well with us. So I would, if the question is what are some ways that hospitals and health systems can partner with people, I would say and encourage hospitals and health systems to ask questions rather than just come with solutions and say, where are you now? What's going on? How can we help you meet these new standards? How can we work with you to equip you? Do you have the people that you need? Do you have a care coordinator? Do you have navigators? Do you have the data that you need? Do you have the analytics that you need? Do you have adequate access to pharmacists when you need them to work with your patients on medication optimization and reconciliation? Do you have nutrition and education support that you need? Can you do telemedicine? Because those are all going to be key components of this new way of doing things. And so I would go with questions rather than assumptions would be one of the ways that I would advise hospitals and healthcare systems.